Okay, thank you so much for the introduction, and let's get started. So today we're going to address pulmonary issues and COVID-19. And first, going to go over some basic facts about COVID-19. Then I'm going to touch on some potential effects on lungs that can occur in the setting of COVID-19 infection. And then finally talk about issues about COVID-19 pertaining to those who already have lung disease. So a few of the basic facts about COVID-19, and I'm sure everyone is having information overload these days. COVID-19 is viral, not bacterial, and that's important in understanding the way that the disease is transmitted and the way that we treat the disease. And of course, the initial outbreak was in Wuhan City, China in December of 2019, and the disease is spread via aerosol and droplets. And this can occur from the oral mucosa, this can occur from the nasopharynx. Anytime people cough or laugh or sing or speak or sneeze, you have the potential to disperse these particles and these droplets, and that's how the disease spreads. So when a person talks, coughs, sneezes, particles are then dispersed, and then they're inhaled into the respiratory tract. And then once they get into one's respiratory tract, they can, of course, cause infection. Another way of transmission is touching an infected surface that has the viral particles on it, something that's been contaminated. It is not as common to get COVID-19 via this route of transmission, but it is still possible to get the disease that way. It's also important to note that most people who get COVID-19 infection, if they are symptomatic, because there are people, if they are symptomatic, most of them will have only mild to moderate symptoms. And you can have, during the course of the illness, either mild, moderate, or severe symptoms. Who's going to get what severity? Well, most people have symptoms that are mild to moderate, and in fact, most people are going to recover within a few weeks. About 80% of the people with symptoms actually recover without requiring the need to go to the hospital. So it's really only a small percentage of symptomatic people that end up being hospitalized. Of those that are having more severe courses of illness, only about 15% are sick enough to require oxygen. And then in terms of the most severe cases, about 5% of people are severely ill enough to actually need to go to the intensive care unit. So it's important when looking at the disease to realize, again, that the overwhelming majority of people, if they have symptoms, the symptoms are only going to be mild to moderate, and only a very small percentage of them, if they become hospitalized, are going to need oxygen, and even a smaller percentage of them are going to need to go to intensive care. In terms of the signs and symptoms, I'm sure everyone's heard many of these before. In terms of the respiratory symptoms, the most common are cough and shortness of breath. The cough tends to be a dry cough, unlike other types of respiratory infection, and shortness of breath, which typically occurs when people exert themselves. And when someone is acutely ill with COVID-19 and COVID-19 pneumonia, they will give symptoms that when they're doing activities, when they're working, when they're walking upstairs, that they notice shortness of breath, but when they stop to rest or when they're sitting down, usually the symptoms abate. And then, of course, there are many non-respiratory symptoms. Fever, which can be as high as 103, 104 in some cases. Chills that go with the fever. Significant muscle aches are also not uncommon. Sore throat. Loss of taste and smell, which interestingly in some people is their only symptom, and unfortunately is one of the symptoms that can persist even after the disease resolves. Nausea and vomiting. Diarrhea. Conjunctivitis, headache, fatigue, and nasal congestion. So there's a very wide array of symptoms, but again, the major pulmonary symptoms are going to be that dry cough and that shortness of breath on exertion. Symptoms can actually occur anywhere from 1 to 14 days after infection occurs. So there is also a lot of variability, and that is part of the reason why when people need to quarantine after exposure, they watch for symptoms up to 14 days because, again, symptoms can occur anywhere in that time period. There are some emergency symptoms to be aware of, and these are symptoms that would prompt you to go to the emergency room or call 911. And those are things such as confusion. If you have someone who has altered mental status, they're not themselves, especially if they're very sleepy and you can't wake them up, that definitely should prompt an evaluation by the emergency room. If you notice people have their tongue or their lips are turning blue or their fingertips are looking blue, that's called cyanosis. And that's important because that's a clear indication that oxygen levels are low. And again, that gives the idea that this is an emergency that needs to be addressed immediately. Not being able to stay awake, increased difficulty breathing. If the shortness of breath gets worse and worse, that's an emergency. Certainly chest pain or pressure, which even without the COVID pandemic, we know chest pain, chest pressure are symptoms that prompt you to go to the emergency room. So again, there's a very wide spectrum of symptoms, but these symptoms specifically are things that would make someone who maybe is at home with COVID-19, it may prompt them to go to the emergency room. In terms of prevention, there's of course been a lot of discussion about this in the news media. However, it's without a doubt that masks work. They both prevent the spread of the infection, they prevent the dispersal of those viral particles and those droplets, and they will decrease the amount of viral particles that you inhale, so they can help both the spread of COVID-19 and prevent you from contracting COVID-19. In terms of what masks to use, certainly in the community, the cloth masks are adequate. They do have some things now available with multiple layers. I think the main point is that the masks cover the nose and the mouth. In terms of other types of masks that are available, such as medical grade surgical masks or what are called N95 respirators, those are really reserved for healthcare workers. The reason that they're reserved for healthcare workers, number one, is because of supply, but also because of the nature of some of the procedures that we do in the hospital, such as surgeries in the operating room or procedures, intubations, where we're likely in close quarters with people and doing procedures where we're exposed to a high amount of aerosol. And then also respiratory hygiene itself is, of course, important, covering your nose and mouth when you cough or sneeze, but also making sure that that mask fits and making sure that it covers the nose and the mouth. If the mask is kind of hanging off, if your nose is out, then obviously you have the potential not only to spread viral particles, but it increases your risk of contracting the illness. And in terms of prevention, another important thing, of course, is hand hygiene, washing your hands and social distancing. In terms of hand hygiene, I'm sure as everyone knows by now, soap and water is the best. And you want to make sure you wash your hands, palms in between the fingers, all the way up to the elbows if possible. And you want to make sure that you scrub and that you wash the hands for a total of 2 minutes. Some people use the trick of singing happy birthday to themselves twice. And the next best thing is the hand sanitizer with 60% alcohol. They're both effective, but certainly if you have soap and water available, that's the preferred method. And then if soap and water is not available or not practical, then certainly isopropyl alcohol hand sanitizer is absolutely fine to use, but you want to make sure that it has at least 60% isopropyl alcohol in it. In terms of social distancing, this is also very, very important. We all hear about this 6-foot distance that we're supposed to keep. And the reason for it is because of those droplets and aerosol that are spread by coughing, sneezing, talking. We find that if we maintain that distance of at least 6 feet, that gives us a good chance that those viral particles, when they're expelled from someone, will basically fall to the floor and not have such a risk of going to another person. Avoiding unnecessary travel. This, of course, came up recently with Thanksgiving, and I'm sure people are anxious to meet with their families for upcoming holidays. But unnecessary travel is unfortunately a risk for spreading and contracting COVID-19. In terms of the reasons, one of them is because people are, of course, in planes, cars, modes of transportation where they're in very close quarters. Certainly that confers a very large risk. You also have people from all different areas, it unfortunately there is a risk with unnecessary travel. So that is something that the state of New Jersey and the CDC has advised against. Avoiding large groups is also important for the same reasons, that the more people and the more cramped together they are, the greater the risk of spreading and contracting the virus. Also, staying home if you're unwell, if you're having flu symptoms, if you're having fever, if you're having a cough, if you're not certain of what the cause is, really staying home from work, staying home from school is very important because of the risk of spreading the disease. And another important thing is avoiding touching your face. We all do it unconsciously during the day, but that is one way to prevent contracting the disease, because of course you touch a contaminated surface, you inadvertently touch your nose, your mouth, and you can get those viral particles inhaled, and again, that can lead to further infection. A little bit about quarantine versus isolation. A lot of people use the terms interchangeably, but they're actually two different things. I'm going to explain what the difference is. Quarantine refers to separating from other people because you have been exposed to the virus. And it really doesn't matter whether the person you were exposed to had symptoms or not. The idea is that you need to stay at home, quarantine for 14 days. And the reason, again, for that time period is, as I said at the beginning of the speech, the symptoms can occur anywhere from 1 to 14 days in the course of the illness. So you really want to quarantine, stay at home after exposure, and you want to watch for symptoms. You want to watch for the cough, the shortness of breath, watch for fever. And isolation is slightly different. Isolation refers more to people who actually themselves have COVID symptoms or have had a positive test where we suspect that the person themselves has the illness, and you are obliged to remain in isolation for at least 10 days and also be asymptomatic for up to 72 hours before going back into the community. Certainly, if you have no symptoms, you want to remain in isolation for at least 10 days from the time you test positive. There is some variability if you ask people about how long the isolation and quarantine needs to be. However, I would say that the longer, the better. A little bit now on treatment. Treatment can really depend on the severity of the disease. And if the disease is mild, meaning maybe just some fever, aches and pains, it's supportive care. It's Tylenol, it's fluids, it's rest, staying home. If you have more severe illness, there are some other medications and therapies that we're using. If you have a severe illness that requires you to be hospitalized, you may need steroids such as Decadron, which is dexamethasone, which has been shown in some studies to help improve recovery. Pronation therapy, if you're diagnosed with COVID-19 or suspected to have it, your doctor or healthcare provider might advise that you try to lie flat, lie prone, or face down on a mattress every once in a while. And the reason for that is because in the typical COVID pneumonia, we find that the disease goes to the more gravity-dependent parts of the lung, which are in the back. So if you lie prone, if you lie face down, if you're someone who has this type of infection in the lung, the blood flow will then go preferentially to the more healthy portions of the lung in front, and that can help oxygen levels and breathing. And it actually can have a very dramatic effect, and it's something that we're using both out in the community and in the hospital as well. Antiviral agents, some are being utilized now in the hospital, things such as remdesivir. We also have what are called monoclonal antibodies. And again, these more advanced therapies are used for more severe cases, mostly in hospital settings. A few things also, hydroxychloroquine initially was a drug that was thought to be helpful for COVID-19. We've had multiple studies now that have shown that it absolutely is not helpful for COVID-19. It is a drug that is very much beneficial for people with things such as rheumatoid arthritis or for malaria or other parasitic infections, but certainly there is no role for using it for COVID-19. Antibiotics, as I mentioned at the beginning of the lecture, this is a viral infection. Antibiotics are for bacterial infections, so since COVID-19 is a virus rather than a bacteria, there's no role for antibiotics. Initially, people were giving azithromycin, thinking that it might help, but it's been shown not to help. Now, if you are sick with COVID and you have what's called a super infection, meaning maybe you're hospitalized with COVID-19 and then you develop a bacterial infection, then by all means, antibiotics are appropriate. But certainly in the normal setting of just an isolated COVID infection, there's no role for antibiotics. And a little bit more on what does not help. I mentioned antibiotics, I mentioned hydroxychloroquine. Vitamins, certainly vitamins can be beneficial for your overall health, and if you have a vitamin deficiency, it may be necessary to take them, but there's really no scientific data that taking supplements like vitamin D, vitamin C, zinc are useful in treating or preventing COVID-19. Herbal supplements, hydroxychloroquine, again, I mentioned no benefit. Drinking alcohol has been suggested by some to help with COVID-19. And it has many effects, but one of the effects is not to help COVID infection. There is no role for ingesting bleach or any kind of household disinfectant or cleaner. Exposing yourself to high temperatures is not helpful. And when the disease first started last spring, there was some suggestion that maybe with warmer temperatures and in warmer climates, we would see less outbreak of disease. But of course, that's been shown to not be true. And again, exposure to high temperatures is not something that will help prevent or treat the COVID. Ultraviolet lamps to disinfect the skin, not helpful. Hand dryers. And again, it's important to know what helps, but it's also very important to know what does not help. A little bit on risk factors for severe disease. So as I said, you can be asymptomatic, you can have mild disease, moderate disease, severe disease. So what are the risk factors for the severe disease? Because this is obviously what people are most concerned about. This is what leads to hospitalization, and this unfortunately is what leads to a lot of the deaths related to COVID-19. So known risk factors for severe disease, people over age 60, unfortunately that's a risk factor. Additionally, there are several diseases, COPD, which is chronic obstructive pulmonary disease, and that includes both chronic bronchitis and emphysema. Having any kind of cancer is a risk factor for severe disease. Organ transplant or bone marrow transplant. Type 2 diabetes mellitus, which is diabetes that is typically managed through diet and oral medications rather than insulin-dependent diabetes. Chronic kidney disease, especially those that are on hemodialysis, sickle cell anemia, morbid obesity, which means obesity to the degree that your body mass index is greater than 35, pregnancy, chronic high-dose steroid use. Why? Because chronic high-dose steroid use can suppress your immune system. So that is a risk factor for severe disease. Heart failure, cardiomyopathy. And there's one other noteworthy known risk factor for severe disease, and that's smoking. Being a current smoker, being a former smoker, both of these increase the risk of severe illness from COVID-19, and that includes tobacco from conventional cigarettes. It also includes electronic cigarettes and vaping. So any kind of smoking does increase your risk of having a severe course of illness. So if you smoke and you want to avoid having severe COVID-19, you need to quit. Easier said than done. It can be very difficult for people, but it is certainly not impossible. And there are a whole host of options available for smoking cessation: nicotine gum, nicotine lozenges. There's oral medications such as Chantix, Wellbutrin. But the bottom line is stopping electronic cigarettes, stopping vaping, stopping smoking. That will decrease the risk of severe outcome. Other possible risk factors for severe illness. So the diseases that I mentioned on the last slide, like COPD and chronic kidney disease, those are known to increase the risk of severe illness. The diseases listed here are possible risk factors, but they've really not been shown as much to be clearly associated with more severe illness. And these are severe asthma, cystic fibrosis, pulmonary fibrosis, liver disease, whether it's cirrhosis or hepatocellular carcinoma, type 1 diabetes, which is slightly different than type 2 diabetes. Type 2 is, again, diabetics that are managed with oral medications, weight loss. Type 1 diabetes is the classic insulin-dependent diabetes, or what they used to call juvenile diabetes. Hypertension, high blood pressure, cerebrovascular disease or a history of stroke, or being overweight but not obese, meaning maybe your body mass index is greater than 30 but not greater than 35. So again, these are other possible risk factors for severe illness, but not clear that they are at increased risk, such as the other diseases. So what can COVID then do to the lungs? Well, if you are infected, it can cause pneumonia. And the pneumonia seen with COVID is not what we call the typical pneumonia. When we think of pneumonia, we tend to think of people having a lot of phlegm, sputum that they're coughing up. Pneumonia in COVID is associated with this hacking, dry cough. It's also associated with fever, and of course, in the more severe cases, can be associated with low oxygen levels. The other thing is that on imaging, if you have a CAT scan of the chest, they may mention something called ground glass infiltrates, and that's kind of a hazy appearance, and it appears to be a very characteristic pattern for COVID-19, which is different than the classic strep pneumonia or staph pneumonia. And again, since this is not a bacterial pneumonia, antibiotics would not be indicated for this. Now, the more serious and often fatal outcome in the lungs is what's called ARDS, and that's also called adult respiratory distress syndrome. What that is there is leakage of fluid in the capillaries that are in the lung, in the blood vessels in the lung, and all that fluid builds up and it makes you unable to breathe, makes you unable to oxygenate your blood, and most of these cases will end up in intensive care and usually on a ventilator. And these cases, unfortunately, are often fatal. And the other issue with ARDS is that there is the possibility of long-term damage, unfortunately. We have had patients that have survived this, but it is a very, very perilous course, and patients are often hospitalized for weeks, sometimes months at a time if they develop this. And again, there is the possibility of long-term damage. So because of leakage of fluid into the lungs, you're not able to breathe, not able to oxygenate. Often people will have to be heavily sedated and sometimes even paralyzed. Why? Because you need to allow the ventilator machine to expand the lungs, and you need to allow so that the patient is not fighting the ventilator. Now, one thing that I mentioned before is pronation therapy, and this is something we're using more and more in the hospital and in patients with ARDS. It's actually a therapy that we used before COVID, but we found that with COVID patients, it's especially beneficial. It's important to note that in the ICU patient that has an endotracheal tube, maybe an NG tube for feeding, multiple IVs, that it's very, very risky when you flip a patient over. So there is a team of people, sometimes 6 or 8 people in the room, actually turning the patient on their abdomen. We also occasionally have pronator beds that actually will rotate a person 360 degrees. Again, or 180 degrees rather, to pronate them, again, to allow for better oxygenation. And pronation can be associated with some problems as well. People were not meant to lie face down for hours at a time, so they may develop pressure ulcers. It may be uncomfortable for them, and you always have the risk of tubes and IVs being dislodged. But again, when done properly in an intensive care setting with enough staff, it can be done very safely and very effectively. Another effect on the lungs that can occur from COVID-19 is what's called thromboembolism, which is blood clots. And unfortunately, COVID-19, among other things, has the propensity to increase your risk of having a blood clot. Blood clots can form in the legs. they can break off and they can actually go to the lungs, and that can be fatal. That can cause shortness of breath, that can cause low oxygen, and it can occur in the setting of COVID-19. And often it's difficult if someone comes in with COVID and pneumonia and they're short of breath and they have low oxygen. It's sometimes difficult to tell if they have a blood clot on top of it. So if they have a sudden worsening in their symptoms, it's something you need to consider. The treatment is with blood thinners, and if you are admitted with COVID-19, even if you do not have a detectable blood clot, you will be given medication, often to prevent blood clots while you're in the hospital, and sometimes even when you're recovering outside of the hospital. Another complication that we see in intensive care especially is what's called pneumothorax, which is a rupture of lung tissue. What happens is the lungs get so diseased, often in the patients with that ARDS that are on ventilators. You have the ventilator pumping positive pressure into the lungs, and that can cause rupture of lung tissue and can actually cause lung collapse. That's something that can be immediately fatal if not corrected, and that's treated with either chest tube or needle decompression, and that allows that air that's pushing on the lung to basically be evacuated. Again, it is something that is not seen really in the community, but is seen in patients with ARDS who are hospitalized, and is one of the unfortunately possible fatal outcomes of COVID. Now, if you have chronic lung disease, what can COVID do to you? And so it's important to know that if you have chronic lung disease, there are certain things that you should monitor for at home, because obviously chronic lung diseases can predispose you to more problems with COVID. So one thing that's very important is to have what's called a pulse oximeter at home, which is a device used to measure your oxygen saturation. And basically the device goes on the fingernail and allows you to measure your pulse and your oxygen saturation. And the idea is that you should, if you're diagnosed with COVID and you have chronic lung disease, check it on a daily basis. If that number is in the 90s, it's consistent, then that's a good sign. But if you're checking it on a daily basis or you feel worse and those numbers drop, and especially if they drop below 90% into the 80s, that's a sign that things are worsening, and that's a sign that you need to go to the emergency room or call the doctor. And certainly people have thermometers at home. They should be checking their temperatures if they are being watched for a possible COVID infection, but having a pulse oximeter is another tool. Another important thing, if you have chronic lung disease, let's say you're someone who has a home ventilator or you use BiPAP for sleep apnea, as many of my patients do, you should be prepared to bring that equipment with you to the hospital. Why? Because if you're hospitalized in isolation, you are going to need this type of equipment. You want to make sure you have the equipment that you're used to using. What about if you're enrolled in pulmonary rehab? I have a lot of patients with COPD or who have had lung surgery that do pulmonary therapy, and it's very helpful for them. Of course, you would need to speak to your doctor one-on-one and kind of talk about the risks and benefits of continuing with pulmonary rehab. I think it's still beneficial, and it is done at the Valley Hospital in a very safe way with social distancing. But if you are uncomfortable being exposed to other people, it is something that you may want to hold off on if you have chronic lung disease and you're at high risk. Another very important thing is if you have chronic lung disease, to get your flu and your pneumonia shot. Flu shots and pneumonia shots will not prevent COVID, but the idea is if you have COVID-19 and then you develop the flu or bacterial pneumonia on top of it, it can be very dangerous. And of course, if you already have the flu or bacterial pneumonia and contract COVID on top of that, likewise, it can be very dangerous. So flu vaccine is really advised universally, and it cannot cause the flu, and should be given really at all ages at this point. Pneumonia vaccine should be given to everyone over 65, but some people with chronic lung diseases may need to get it at a younger age, and those are to prevent, again, bacterial pneumonia. Another important thing to remember is if you have chronic lung diseases, emergencies are still emergencies. So if you have asthma and you have an asthma attack, or you have COPD and you're having a COPD exacerbation, you need to call the emergency room you need to go to the hospital, you need to see your doctor, you need to do those things. COVID-19 is scary, and people understandably don't want to be exposed to others who are potentially ill in the community, but you don't want to let that prevent you from taking care of yourself if you have an emergency condition. Now, a few examples of chronic lung disease. What if you have asthma? What to do during the COVID pandemic? It's important to have an asthma action plan. An asthma action plan is a set of steps that you take if you have an exacerbation. For instance, if you have a rescue inhaler, you should make sure you have a good supply of that at home. If you check your peak flows to see how well your breathing is at home, you should make sure that you keep up with that. You should also avoid triggers. And one thing to consider is if you're an asthmatic who is prone to getting asthma attacks from strong odors like bleach, cleaning solutions, well, you still have to clean your house, you still have to sanitize, right, with bleach or ammonia, and these can be respiratory irritants. So, for example, if you're a severe asthmatic, you may want to have someone else do the bleach or ammonia treatments while you're in another room. You want to make sure that the room is well ventilated because, of course, you want to disinfect all the surfaces around you, but you may not want to expose yourself to that. Also, if you're going to be cleaning at home and using ammonia or bleach, and it does tend to trigger symptoms, one thing that's helpful is to actually spray it right onto the towel and then wipe down the surface rather than spraying it all over, because that has the potential to spread the aerosol and can be very irritating. What if you have lung cancer? Again, make sure you have adequate medications, but a very important point is if you have lung cancer, you may be undergoing chemotherapy, you may be undergoing radiation treatments, you may be on oral medications, on immune medications, things like Tarceva, or maybe you take Keytruda. It's very important not to stop these medicines. Some people might be concerned that some of these diseases, some of these treatments may affect their immune system. And yes, some of these treatments can affect your immune system. However, if you suddenly stop treatment for your underlying cancer, that can be very dangerous as well. So if you have lung cancer and you're being treated by an oncologist, don't take it upon yourself to just stop the treatment because of fear of COVID. Of course, contact your oncologist, talk to them. Same thing with immune therapy, because that ultimately can be very dangerous. What if you have other illnesses such as pulmonary fibrosis or COPD? Avoiding triggers, having adequate supplies of medications, keep taking medications, including steroids. Steroids are immune suppressants, but some people are dependent on them for their breathing, and suddenly stopping them because of fear of COVID might be a problem. And while taking high doses of steroids might predispose you to higher risks of severe COVID disease, again, don't stop these medications without talking to your specialist. A couple of other types of patients, if you've had a lung transplant or HIV and you are indeed immune compromised, or you're on high doses of steroids or drugs such as tacrolimus or mycophenolate, again, do not stop these immunosuppressive medications. If you've had a transplant, one of the major causes of illness and even death after transplant is rejection. And so stopping these medications can be very, very hazardous. And the same goes for steroid medications as well. And again, always have an adequate supply of medications. Now, what if you're a patient who is on a home ventilator, or you have a tracheostomy, or you take care of a loved one who has a tracheostomy? You want to be very careful, obviously, if you're cleaning their equipment. You want to make sure that you, number one, have either viral or bacterial filter attached to any tubing. You also want to make sure you clean all suction catheters on a daily basis, and the best way to do that is with 50% hydrogen peroxide. If someone's on a ventilator, you want to, and is also someone with a tracheostomy, you want to try to change those tracheostomy tubes frequently, if possible once a week, but otherwise certainly every 3 months. And make sure you have spare tracheostomy tubes at home. If you are cleaning them, you want to clean them with a brush, hot soapy water, or 50% hydrogen peroxide, and allow it to dry in an airtight container. And you always want to wear gloves if you're going to be handling someone's home ventilator equipment, cleaning or tracheostomy. You should not only have a mask on, but really should have eye protection with goggles or face mask, gown, and gloves, because again, the disease, as we know, is spread by aerosol, and handling anything with respiratory secretions has a risk of exposing you to it. What about recovery and prognosis from the disease? Well, as I said, most people will recover and most people will not require hospitalization. How many people will have long-term improvement, or how many will have permanent problems from COVID? It's really not known. Some people, for whatever reason, seem to recover very quickly, others do not. Some general guidelines are to obviously continue taking your medications during recovery, make sure you exercise, try to increase your activity level as much as you can, eat healthy. Unfortunately, some people may become what we call long haulers. And these are people who, after the acute phase of infection from COVID-19, unfortunately develop lingering symptoms. And the lingering symptoms are varied. Shortness of breath is one of the ones that I see quite often in my practice. And unfortunately, it's not always clear why people are short of breath. Some people may have had pneumonia or ARDS and may have scarring in their lungs, but oftentimes people will actually have a normal X-ray or a normal CAT scan and still have significant shortness of breath. It's not really entirely clear why that is. There are people that may have other medical problems that can cause shortness of breath after the illness. Blood clots can develop after the acute phase. People can develop also what's called cardiomyopathy. So your physician or healthcare provider may want you to get a CAT scan even after you've recovered from the acute phase of illness. They may want you to get an echocardiogram to make sure that that heart muscle is not affected. Cough can persist for a very long time, sometimes treated with inhalers. Fatigue is one of the most common symptoms I see, and not just sleepiness, but overwhelming tiredness where people really can't work or people cannot stay awake during the day. That's something that's unfortunately common in long hauler patients. Joint pain and chest pain can occur. Also, there's a phenomena known as brain fog, where people feel that they are confused and their attention is not optimal, and they can have that sensation for weeks, sometimes months after the infection. Depression and anxiety are common, muscle aches, headaches, and something called paresthesias, which are numbness or tingling in the arms and legs. Again, it's not entirely clear how the virus causes all of these issues, but there are increasing reports of this, and it is something that is currently being looked at. What about the COVID vaccine? Well, there's very good news about it. I know that it's started to be given in the UK and is soon to be given to the public in the United States. There are several vaccines. The vaccines are new. They work by what's called mRNA. Classically, vaccines work by using what's called a live or attenuated virus. These vaccines, or sometimes they use viral proteins, these vaccines work on messenger RNA, which is genetic material. And it's a technology that's been studied actually since the SARS outbreak a few years ago, but is now being utilized, and the studies that they've done have been very, very positive about outcomes in terms of effectiveness. Should you, and who's going to get it? Likely first responders are going to get it first, healthcare providers, people in long-term care facilities, and the elderly, people with certain chronic health conditions. Should you get it? I think ultimately everyone should strongly consider getting it because it, again, has been shown to be effective, and you need to decide for yourself. You need to weigh the risks and benefits, ask questions, look at the data, and of course talk with your physician. But I think ultimately it is something that is going to be very helpful and hopefully will end the pandemic. And I know we're all very, very anxious for that to happen soon. So just to review in summary, COVID-19 is a viral illness, not bacterial. Most people will recover. It can cause pneumonia. It can lead to blood clots in the lung, can cause pneumothorax, and in really severe cases, this ARDS, which leads to people requiring ventilators. It can also, unfortunately, lead to lingering symptoms like shortness of breath and brain fog, and we do have long haulers now, unfortunately. Anyone is at risk of getting COVID-19, but there are certain health conditions that put you at risk for a severe course of the disease. And again, being over age 60 and having certain lung diseases such as COPD and other diseases like chronic kidney disease puts you at increased risk for severe courses. If you have lung disease, make sure you have plenty of medication at home. Make sure you have your necessary equipment at home. Get vaccinated for flu and pneumonia. Don't stop your treatments or medications, even if they are things that can suppress your immune system, without talking to your healthcare professional, because again, the risk of stopping those medications may be more dangerous than anything. Don't delay care. An emergency is still an emergency. So if you're having an asthma attack, go to the emergency room. Don't say, I'm not going to go to the emergency room because there's COVID out there. Hospitals, emergency rooms are isolating patients. They're aware of the risks, but you need to make sure that you take care of that emergency. And most importantly, wear a mask, social distance, clean, disinfect. And with that, I will open to questions.
Hi, great. We do have some questions. Do want to remind anybody, if you have a question, you can email us at elucas, LUCAS, @valleyhealth.com. Okay, we'll jump into the few questions that we did already get.
Okay.
Is there any known reason that taste and smell are affected by COVID?
It is not clear. It appears to be a effect of the virus. And some people just have a loss of taste. Some people just have a loss of smell. It's not clear why it happens, and it's also not clear why in some people it's very temporary and in other people it persists for a long time. So there is no clear answer of why it's happening, but I'm sure it's one of the many things that will be studied going forward.
Oh, thank you. If somebody in your household is positive for COVID, how do you best protect yourself and the rest of your family?
So the same rules for quarantine apply and isolation. So if you're sharing a house with somebody, that person needs to be kept in separate quarters. If you have common areas like a common bathroom, it's very important to clean and disinfect the common areas. If you're have to go into the room, you want to obviously mask and practice good hand hygiene. And if you have also sharing a kitchen, you want to make sure you don't share utensils, cups, plates, things like that. So you really want to make sure that the person, even though it's in their own home, is quarantined for those same 14 days as a stranger would be.
So to tag along to that answer, what about the ventilation in the house, in the grocery store, things like that?
Ventilation in terms of?
I guess heating systems within a house.
I think that heating systems within a house, there's no specific risk that it's necessarily going to transmit it from one person to another. Viral particles, again, if they're traveling more than a few feet, are probably going to disperse. So if they're going to go through a ventilation system from one room to another, it would be very unlikely that it would be enough particles to kind of cause disease from one person.
Okay, thank you. If somebody is breastfeeding and comes down with COVID, should they continue to breastfeed or stop?
That's an excellent question, and the answer is that you would want to talk to your lactation consultant and your OBGYN. I'm not sure whether that's really been studied. Again, this is all very new, and of course, breastfeeding has benefits, and there are certain conditions where it is contraindicated. But the answer to that is I don't know, and that's something you want to discuss with OBGYN or lactation specialist.
When is somebody the most contagious?
I think in terms of timing, I would say it's anywhere in that 1 to 14 days after they're positive. So in other words, are they more contagious the day they test positive or a week or 2 weeks? I'm not sure there's really a difference. I think the reason that we keep people isolated for that amount of time is because we don't know if they're more contagious on day 1 versus day 5 versus day 10.
All right. And that is all of the questions we have for you today.
Okay.
I want to thank you, Dr. Suffin, for your informative presentation. That was fantastic.
Thank you.
We have